Hello, everyone, and welcome to Your Health in Your Hands. I'm Dr. David Ajibade with the Brain and Body Foundation. Now, if you remember, a couple of weeks ago, we raised the alarm about Alzheimer's dementia being the number one cause of death in the United Kingdom today. Now, dementia is a disease of the brain that causes a person to gradually lose their, how shall we say now, their faculties, beginning with memory, usually, and then speech, and then behavior, and then mood swings, and eventually the person becomes bedridden, and eventually the person dies, usually from an infection, a lung infection like pneumonia, or a urinary tract infection, or some other, or a fall, or some other thing, because basically the brain just keeps on shutting down and shutting down and shutting down until the person is unable to do anything and unable to defend themselves, whether internally or externally. So that's dementia in a nutshell. Now, here's the thing. It is rising across the world. The fact that we're still very, very young in Nigeria and Africa, the average age is still mid-50s. Dementia starts from 65 and onwards. That's when you first start noticing the problems of dementia. But here's the thing. Most times it happens, the seeds, or let's say the building blocks to having dementia, start about 20, 30 years prior to the first symptoms. First symptoms could be forgetting certain things that you're not supposed to forget, or saying the wrong words, or missing your words, or something like that. That is clearly a problem. Not just that you forget your keys, or you forget where you put your toothbrush or your toothpaste. It's a clear problem that you're like, oh, this is not usual, and it's happening over and over and over again. And some of you may be able to relate to that. So it starts, like I said, about 20, 30 years before the first symptoms, which means that if you're in your 30s now or earlier, it's of vital importance that you understand the principles and the rules behind the development of dementia, so you can be able or more apt to make the right changes so that it doesn't get to that point. Because Nigeria is, yes, we're still, I think it's like 53, 54 years of age is the usual lifespan. That's average lifespan. But there are people who are obviously living to their 80s and 90s and beyond. And we are beginning to see, both here in Nigeria and in the US, we're beginning to hear of, and I'm beginning to have patients more and more and more who are dealing with dementia. And so it's important that you understand this disease to a better extent. So we're going to take you through what is the standard approach to treating dementia, what is understood, and what the research is all pointing to. And then we're going to take it over to our practical approach at the Brain and Body Foundation. Because as you know, in the US and other developing countries, they approach it from the standard approach, which means that they have all this technology, the MRI, the special scans, and the special drugs, which are super expensive, and they can approach from that angle. But it's not going to work too much in Nigeria, certainly not in remote areas. And of course, remote areas also have dementia as well. So we are focused on the fundamentals, as always, whether it's for sickle cell disease, whether it's for autism, cerebral palsy, whether it's for dementia. So we're going to look at what is actually practical, what can actually be put into practice, not just in tertiary hospitals like UCH and Luth and Abuja and all the other wonderful hospitals, but what can actually be practicalized in local clinics so that this coming tsunami, so to speak, is not going to affect us too much. So we're going to look into that a little bit. But the first point I want to bring up, and this is from really extensive study, they're looking at things from different angles. The first point I want to bring up is what histopathologists, now the histopathologists are people, experts, look at tissue, whether alive or dead. They take samples, biopsies, and look at it under the microscope, or look at it in general. And they say, okay, this is what is the disease, what the disease is. Or they will say, this is what caused this person to die. So histopathologists who look at the brain, who are specialized in dementia, this is what they are beginning to find out. And I've heard a couple of them say this. They have seen in post-mortem studies now of dementia, of people with, of brains, post-mortem brain studies. They've seen brains that have a lot of amyloid plaques. Remember, amyloid plaques has a lot to do with dementia. More on that later. They've seen patients with a lot of amyloid plaques, but yet no problems with their memory or cognition or speech or whatever it is. They just had the plaques, but they were fully functional. They've also seen a lot of patients with tau tangles. Tau tangles is another thing related to Alzheimer's disease or Alzheimer's dementia. And yet, no tau tangle, no cognitive deficits. They were still speaking, acting like normal people until the time of their death. They have seen brains with both tau tangles and amyloid plaques and still functioning normally. Now, here's the kicker. They have never seen a brain at postmortem that has tau tangles, amyloid plaques, and vascular damage. Vascular refers to the arteries and veins in the brain. They've never seen that. In other words, what they're saying is that for you to really exhibit, or one of the key things to making dementia is that there has to be vascular involvement, damage to the blood vessels. I want you to understand that. And I'm really trying to take my time and emphasize this, because this is not really what is being talked about as much in the whole field of dementia and brain disease. We're all focused on the amyloid plaques, the tau tangles, and other pathologies, but the blood flow, the blood vessels themselves is not as emphasized. And remember, it's the only way your brain gets the nutrients, the oxygen, the nutrients it needs is through your blood vessels. So if your blood vessels are diseased and they're not able to take blood to the brain, then there will be a problem. So we're going to get into that a little bit more. And the reason I'm bringing this up again is this. They are finding out that Black people, and Black women in particular, have much higher rates of dementia than white people do. I mean, this is a gift that just keeps on giving, right? It's everything you look at: cancer, heart disease, dementia. You keep on seeing the same thing popping up. Black people have a problem. Black people have a problem. Black people have a problem. That's the hand we've been dealt. Let's deal with it. So that's what they're saying. That Black people in general tend to have it worse. And all over the world, dementia is growing. So it's going to come and hit us here in Nigeria as well. So we best be prepared and start putting into practice the common sense steps to help protect our brains. And protecting our brains obviously has to start with protecting our blood vessels. The question therefore should be, what does it take to have a healthy blood vessel or have healthy blood vessels? What does it take to have a healthy cardiovascular system? And if you remember, our very, very, very first show, the very first episode on this show, about 4 years ago now. Yeah, about 4 years ago. I think we started in November 2018. So it's about 4 years now since we've been talking about it. The very, very first show was on cardiovascular disease. I remember we were talking about something called endothelial dysfunction. Endothelial referring to the inner lining of the blood vessels. And we're talking about why endothelial dysfunction is the key to cardiovascular health. So we're going to talk a lot more about what it takes for your blood vessels to be healthy and strong. Because if you don't focus on that, if you don't focus on those basics, as the histopathologists are suggesting, we may be wasting a lot of time just focusing on the plaques and the tangles without looking at the blood vessels. So we're going to take a little bit of time and look at that. All right. Okay, welcome back. So to reiterate, one of the most important things to protect your brain, to protect your heart, and really in general, is that you've got to do everything you can to ensure that there is adequate blood flow from the heart to the brain. And if you look at those of you who are in the medical field or studied human anatomy, the top priority of the heart the top priority of the heart when it's pumping blood out is to first of all supply itself. The next thing is to supply the brain, because these are the two most important organs in the body. It supplies itself, obviously, because if it's dead, the brain is going to get nothing. And then the next thing, of course, is the brain. The brain is the master organ, the master controlling system, is the general, is the top gun, top dog, whatever you want to call it. That's the most important organ in the body, because it regulates the functions of every other organ. So your job or your mission, should you choose to accept it, is to ensure that blood flow is maintained from the heart to the brain. And that there are different things that are involved in it. I'm just going to point out some of the most important things. All right. Well, I've divided into two, having excess and not deficiency. So excess means that you're having too much of something that either you shouldn't have at all in the first place, or you should have just a certain amount from. So the obvious thing is blood pressure. You've got to keep your blood pressure under control. And most, from what I've seen, from my patients and from my interaction with other healthcare professionals and from the data, African Americans, Nigerians, Africans in general have more trouble managing their blood pressure than white people in general. Part of it, as I've said over and over and over again, has to do with vitamin D, but I'm getting ahead of myself right now. Next thing is blood sugar. You've got to control your blood sugar, but it's not just about blood sugar. We'll probably do another episode on this, blood sugar and diabetes. But it's not just about blood sugar, it's also about insulin, because when blood sugar rises, insulin rises as well, if you're not type 1 diabetic. And once insulin rises, it can cause a lot of problems. The problem is that most medical treatments, most medical approaches focus only on the blood sugar. They don't address the blood insulin, which is a problem on its own. So you want to make sure the blood sugar is normal. So really, I should add blood sugar and insulin. But that is a big problem. It can cause all kinds of problems, including cancer and dementia. It's one of the big risk factors for dementia. By the way, on our website, you can get the dirty dozen. So just go to our website, brainandbodyfoundation.org. You can get our free report, the 12 eyes that lead to dementia, the dirty dozen, that's what we call it. The dirty dozen, the 12 eyes, they all start with the letter I. So insulin resistance, insufficiency, injury, illness, things like that. 12 of them that talk about how the things that can lead to dementia and how you can avoid them. I think you should get it. It's free of charge. So trans fats, again, this has to do with processed foods. Our world is becoming more and more processed, fast foods. Not very good at all. People are surprised when I talk about vegetable oils, but the data is out. Vegetable oils, groundnut oil, canola oil, whatever oil, those oils that we're frying all the time can cause damage to the inner lining of the blood vessels. That's what I'll call it. And cause inner line. And I did a whole series on inflammation. So this inner lining of the blood vessels has to be smooth, like a baby's bottom, very smooth. Once you start having all these toxic things in your body, high sugar, high stress, even having high blood pressure, high insulin, it causes damage to the blood vessels. And this is what makes things like cholesterol, calcium, and other things stick to the lining and eventually cause blockage. So you want to minimize them. There's a lot to eat. We're just pointing these things out to you so that you can go ahead and read and find out for yourself. Starchy, anything that has a lot of carbohydrates is not good for you, especially after you turn 40, 50. Your body just isn't able to handle it as well as it could when you were in your 15s, your teens, your early 20s. Cholesterol, there's a lot of controversy about cholesterol, but there's obviously there's the bad cholesterol, LDL, and then the very low VLDL, which is very low density lipoprotein. I don't know what's happening there. Okay, and then of course I mentioned insulin. Again, these were just highlighting these things for you to go back and read. As a matter of fact, when it comes to insulin and blood sugar, they say it's a much better test of your ability to handle blood sugar is not the H1AC or the blood sugar levels. It's really your insulin levels, what they call insulin resistance. That's what determines that. If you do that test, you don't even have to do a blood sugar test. And I've done both. I've done the blood sugar test and I've done the insulin resistance test, and I passed with flying colors. Of course, it wouldn't make much sense if I didn't, because I try to do the things that I'm trying to teach you. So I don't have any problems here at all. My cholesterol is a little high, but it's not the very low, the VLDL is the most important one, and I'm okay there. Cholesterol, because I eat meat, right? And I'm not going to stop eating meat. But I also know what to do to offset that risk factor. The other thing I want to talk about is stress. If you're stressed all the time, you already know that stress can kill. It's called the silent killer for not, and it's not for, and it's not without reason that it's called the silent killer. So stress, you want to avoid the stress. Therefore, you have to sleep well. You want to, especially your close relationships, you want to ensure that you value your close relationships, your partner, your spouse, your siblings, ensure that you have good, at work again, ensure you have good relationships. And if you have issues with anybody, you want to deal with them as soon as possible. You want to confront it, address it. So and you want to make sure that harmony and peace is kept at a premium. If it's work, if you are working for long hours at night, know that you are at risk, and therefore you need to take the necessary steps to mitigate that problem. All right, I don't know how much time we have left, but let's move on to what is not enough. Because I think you need to focus a lot more on this. This is a priority. And most people just don't know about this. Everybody, the advice is like, oh, just go outside, exercise, you'll be fine. Exercise, what else? Sleep well. And a lot of it is just this general, non-specific advice that's been thrown out from the medical field. And I just think it's not enough. You've got to be more specific, especially when people are dying the way they are. I mean, we've been talking about these for the past, these tips on how to maintain heart health, how to maintain brain health for the past few decades. And still cardiovascular health, cardiovascular disease, heart disease is still the #1 killer around the world. So clearly, either people are not following these tips and this advice, or they're not following it, or they're not being given the right kind, the more specific kind of advice so that they can take control of their health. So I like to deal with specifics. So let's go to specifics. You need vitamin D3. I always talk about vitamin D3, and I will never stop talking about vitamin D3. Even during the pandemic, as you remember, I was shouting about vitamin D3 before, during, and after the pandemic. And I still continue to shout, especially for Black people. Vitamin C is very important for everything in the body, including the brain, but it also helps to heal because it helps you make collagen. Collagen is part of what makes the blood vessels strong and healthy. So vitamin C helps to heal, helps to rebuild collagen and helps to heal the blood vessels. You want magnesium because magnesium helps to relax the blood vessels. I'll tell you my story probably in a few minutes, but magnesium is very, very important. And there's a lot of data that shows that we are not getting enough magnesium in the body. Potassium, as you grow older, your potassium levels diminish. This again, almost nobody talks about potassium, and we are not getting nearly enough potassium in our body that the body needs. So potassium is also needed. I mentioned the B vitamins. I refer to B vitamins as brain vitamins because they are so important for the brain, but they're also important for the cardiovascular system, the blood vessels as well. One of the reasons why they're important for the cardiovascular system is that they reduce a substance called homocysteine. Homocysteine is, if it accumulates in your body and gets too much, and we test for that as well. I tested mine, it's perfectly normal, of course. Homocysteine gets sticky. It's a protein that gets sticky and it can actually adhere or attach itself to the lining of the blood vessels and cause platelets and other kind of crap to stick to it and cause damage. So you don't want homocysteine bad in your body. And the vitamin B complex can help you do that. You need to have the right kind of vitamin B complex, obviously. The most important things in the vitamin B complex are niacin, vitamin B3, B6, B12. I talk about nitric oxide. What nitric oxide does is produced by the inner lining of the blood vessels, and it's a gas. Once it's produced, and in healthy blood vessels, it's produced a lot, it helps to widen it, dilates the blood vessels so blood can flow through and therefore get to the brain where it needs to work. If you don't have enough nitric oxide, you are not going to have enough dilatation. So one of the things, people who have hypertension have very low nitric oxides. People who don't have very good, who have erectile dysfunction, who are not having it, who are not able to get it up and keep it up, have low nitric oxide. So you need supplements that can help to strengthen, or foods like beets, they can help to boost nitric oxide production. We have a formulation that has all of these things, plus nitric oxide, that helps to boost nitric oxide production, by the way. So obviously you need quality sleep. One of the most important things that we're learning is that sleep helps you repair your brain. It helps you repair your blood vessels, but you need a lot of sleep. You need like 7 hours of sleep. And we'll talk about in cases where you can't have enough sleep, we need to talk about mitigating factors, things that you can do to ensure that the quality of sleep you have you have very good quality sleep, and also you can mitigate or reduce the damage that is being done as a result of lack of sleep. I remember speaking at a conference to military generals, and they were laughing at me when I was talking about 6 or 7 hours of sleep. They're like, where are we going to get that kind of time from? Well, obviously, there are certain occupations that make it difficult to do that. Again, you need to be able to mitigate against the damage that is done as a result of lack of sleep. All right, so omega-3s, I talk about omega-3s a lot. So we use it at our foundation for kids with brain damage, extremely important. Omega-3s are also very important to ensure that the blood vessels are healthy and strong. Vitamin K2 works with vitamin D3, so vitamin K2 and vitamin D3, they both work with calcium, amongst other things. So vitamin D3 helps you absorb calcium from the guts. Vitamin K2 helps you take calcium from the blood vessels and put it inside. So it takes calcium into the bones, right? So vitamin K2 takes calcium out of the blood vessels and puts it in the bones. Many times we talk about calcium in the blood vessels causing damage to the blood vessels. And many times it's because people don't have enough K2. So what I have is, I bought this. This has both vitamin D3 and vitamin K2 in it. So you can see that there, vitamin D3 and K2. So I have a combination. I take a lot more. Now, what is in my opinion, the absolutely ridiculous recommendation of 600 international units? I believe as a Black person, you should take nothing less than 10,000 international units. And if you're concerned about high calcium, that's probably the only serious complication of vitamin D3, excess vitamin D3. And the Mayo Clinic says you can take the Mayo Clinic on their website says you can take as much as 60,000. It's only when you're taking 60,000. Think about that. 600 is the recommended. The Mayo Clinic has found out that if you take 60,000 regularly for months, that's when you can talk about toxicity. So I'm just saying take 10,000. I take a lot more than 10,000. I won't tell you how much, but I think you can start with 10,000. And of course, you're going to take vitamin K2 as well to offset the calcium excess. I suggest you take that as well. Chromium is very important for insulin sensitivity. It helps you absorb glucose into your cells. So you need chromium to help you absorb glucose into your cells. And that will help with diabetes. That's another thing I want to recommend. So there are about 10 of this to about 8 of this. If you focus on getting the right kind of supplements, I honestly don't know how anybody can do all this every single day just by eating the right foods, whatever that means, or by eating a balanced diet. Honestly, I don't think it's possible. So because you got to take a lot of time preparing foods. You got to buy fresh foods. You don't want to buy processed foods. And if you're doing that on a daily basis, unless you have a spouse who's willing to do that for you while you go to work and have it all prepared for you when you're back from work, I just don't see it happening. So I just say, listen, take the right kind of, just make sure you're getting the right kind of nutrients in supplement form, like vitamin D3. There's no way you're going to even get it from food. Unless you're out in the sun naked 2 hours a day between the hours of 10 a.m. and 2 p.m., then you're not going to get enough vitamin D3. So focus on getting supplements. Don't let anybody tell you that supplements are not important, because that is simply not true. All right. In the next step, I'm going to talk a little bit about my story and how I personally apply this. So stay tuned. Okay. Guys, I still need to round up for All right, welcome back. So, uh, all right, welcome back. I want to say a few things about my. Welcome back. Let's talk about me for a little. All right. All right. Welcome back. I want to share a little bit of my story dealing with hypertension and dealing with some health issues. So I went to, welcome back. I want to share a little bit of my story on my issues dealing with hypertension and other health issues. So when I traveled to the US, this was right in the middle of the COVID-19 pandemic. So a lot of the gyms were closed. We couldn't enter. Many institutions were closed. And had to do with the work of what I do with the foundation. I had to travel all over the country. And I drove from one end of the United States to the other end. That's about 3,000 miles on my own. So I got to see a lot of the country, and I got to see how different people were living and how different people were responding to the pandemic. But in the process, because I wasn't exercising, I wasn't eating well. I was probably eating too much. I began to gain weight. As a matter of fact, at my highest, I was 220 pounds, which is over 100 kg. Think about that. That would be Michael Jordan. Michael Jordan at his height and his peak was 220 pounds, and he's over a foot taller than I am. And he was extremely active. I was nowhere close to being active. So in the process, without my knowing it, I developed, as I having high blood pressure. I developed it. I found out when I went to a church. I believe it was in Houston, or Joel Osteen's church, and they were giving out free blood sugar tests and hypertension tests. And they warned that Black people have it worse when it comes to high blood sugar and higher hypertension. So I went and checked those two elements. Obviously, my blood sugar was perfect as always. Or the hypertension, were like, whoa, they checked a few times and it was high. And I thought that I had been doing all the right things. I was taking the cardiovascular formulation that I talk about that helps to boost nitric oxide. Apparently, I wasn't doing enough. So big deal. I got to start my blood pressure medication. So I started the medication. I think it was amlodipine, which again is which is best for Black people. It actually addresses calcium. It's a calcium channel blocker. And so I started using amlodipine, and then it reduced my blood pressure. I had to use one twice a day. But here's what happened. I got back into playing squash, and obviously to reduce my weight. And then as I'm playing with my opponent in the court, it would be like as I'm about to move to the ball, I'll just feel like something seizing my knee. It was almost like something was wrapped around my knee and squeezing it. And I was like, what the heck? This is not right. I'm not able to play. And I guess my opponent in the court, so one of my squash partners, he's a vascular surgeon. So I asked him, I said, well, does amlodipine do this? He's like, yeah, it causes muscle weakness, and it also causes joint aches and joint stiffness. And I'm like, here I am trying to lose weight. I'm trying to reduce my weight. I'm trying to get healthy. And now I can't do that because of the drugs that I'm trying to use to save my life. That's always a catch-22 situation. So I started looking into it, and I realized, I started saying, okay, what else can be done? So I found out again about magnesium. I'd already been taking vitamin D3, been taking vitamin C. I kind of stepped up on my vitamin C. And I took a few of these other things, but magnesium I found out was the most important thing, along with potassium. I actually have it here, a combination of magnesium and potassium. It's a magnesium potassium complex. I started taking that. And these are really big pills. I gotta say, it's not the easiest thing in the world. But I started taking it because I didn't want to gain weight again. And so I started taking it, and I bought a blood pressure monitor just to ensure that it was working. So I was taking them along with the amlodipine, and I'll test every single time. And I'll test and test and test and test. Well, long story short, after a while, I was able to get off the amlodipine and stay on my magnesium. But it's hard. I got to take magnesium like 3-4 times a day. And it's just, but I just really, like I said, I wanted to get back into exercise, and I couldn't do it. I'm saying this, I had to think carefully about before saying this. This is not to that you should, this is not a reason for you to get off your medication. You need to be on your medication. I'm a doctor, so I know how to balance things out, and I know how to monitor myself closely. I am always checking my blood pressure. Always. Don't say that it's not my portion. I'm not going to worry about it. I'm just going to take some supplement of magnesium. I'm not going to worry about it. Not true. You've got to constantly be testing and checking, and you've got to be on your medication. And I say this because there are other people I know of who are on medications like 3, 4, 5 medications for hypertension, and they're not getting their blood pressure lowered. I'm saying that you can actually add this to whatever you're doing, magnesium and potassium to whatever you're doing, and maybe vitamin D3 and vitamin C. I've actually had friends who were just on vitamin D3 and vitamin C plus their blood pressure medications, and it dropped it really well. So this is for healthcare professionals as well. This is something that your patients might be missing out on. And don't say that you're going to test the magnesium levels. I tested mine were perfect. And part of the reason is that it tests only the magnesium in the bloodstream. It doesn't test for magnesium inside the cell. And that's probably more important. And so my magnesium in the cells, my cells could have been low. My magnesium in the bloodstream was perfect. So my point being that magnesium is something that everybody, in my opinion, should be supplementing with. Again, Black people are deficient in magnesium for whatever reason. So you might want to consider adding magnesium, and if you're over 50, adding potassium to your regimen in addition to your blood pressure medication. And that might be the missing link. As in so many of my patients too, it might be a missing link in what you're missing when it comes to controlling your blood pressure. So I'm going to just throw that out to you free of charge. So again, we're saying all this to say that the blood pressure, the brain, right there, the brain, one of the things that leads to dementia is poor blood flow. If your blood flow to the brain and within brain cells, so these are brain cells, you got to be able to get to the brain cells, especially the parts of the brain that are very active, metabolically active, like the hypothalamus. It's an energy it's a guzzler. It's an energy guzzler. It needs so much oxygen. It needs so much glucose and ketone bodies and fats and all those things. So if that is compromised, you are on the track towards getting dementia, which means your memory is going to start failing, which means that eventually your speech will be affected, your movement will be affected, and it can cause problems further down the road. So you want to ensure, it's very, very important, especially if you are Black, that you ensure that you have adequate blood flow to your brain. Adequate blood flow to your brain. And we talked about the things that can compromise that blood flow. We talked about the things that you need to do to ensure that your brain is getting enough blood flow. And these are the things right here. There's a lot more to talk about, but our time is up. So thank you so much for listening. Remember to follow us on our social media platforms. If you want to rewatch all these videos, they're on the NTA YouTube sites. They're also on our YouTube site as well. Remember to get the Dirty Dozen from our website, brainandbodyfoundation.org. Till then, stay healthy, stay strong, stay on top of things that have to do with your health and that of your family. God bless. Take care.